Sciatica pain does not just hurt, it stops you. That sharp electric shock shooting down your leg can make it impossible to sit, stand, or even sleep. And when it hits that hard, you want one thing, something that works fast. But here is where most people go wrong. They grab the nearest medicine, hope for quick relief, and end up either getting no results or making things worse. And this might surprise you. The wrong medicine can actually keep you in pain longer. Because sciatica is not like normal pain, and if you treat it like one, you are already on the wrong path. Stay till the end, because the last point is the one most doctors forget to tell you. Before we talk about treatment, you need to understand one simple truth. Sciatica is not a disease. It is a symptom. It happens when the sciatic nerve, the longest nerve in your body, gets compressed or irritated. This can be due to a slipped disc, a bone spur, or narrowing in the spine. That is why the pain travels from your lower back into your hip and all the way down your leg. But here is the key point most people completely miss. The type of pain you feel tells you what is actually causing it. And if you ignore that signal, you will keep choosing the wrong treatment again and again. Medicine 1. Fast relief painkillers. For most people, treatment starts here with simple painkillers. Medicines like ibuprofen or diclofenac are commonly used because they reduce inflammation around the nerve. And when inflammation goes down, pressure reduces, and pain often improves within hours. This is why they feel like a quick solution. If you have ever taken ibuprofen and felt better for a few hours, only for the pain to come roaring back, this is exactly why. They calm the surface, but they do not touch the root. And here is the part most people ignore. Just because something works fast does not mean it is safe to keep using. Over time, these medicines can damage your stomach lining, affect your kidneys, and increase heart risks. They feel harmless because they are easy to get, but that convenience can be dangerously misleading. Used correctly, they help. Used blindly, they create new problems. Medicine 2. Nerve pain medications, the real. Now here is where things change completely. If your pain feels burning, tingling, or like electricity running down your leg, regular painkillers often fail. Because this pain is not just inflammation, it is the nerve itself firing in distress. This is where medicines like Gabapentin or pregabalin come in. They do not just block pain, they calm the nerve itself. They change the way your nervous system processes the signal at the source. But here is the mistake most people make. They expect instant results. And when nothing happens in the first few days, they quit too early. These medicines need time, sometimes 1 to 2 weeks, to build up properly. But once they start working, they provide deeper and more consistent relief than any basic painkiller ever could. Slow start, but far stronger impact. Medicine 3. Muscle relaxants. Here is something most people never realize. Sometimes the nerve is not the only problem. The muscles around it are actively making things worse. When pain begins, your muscles tighten automatically to protect the area. It is a reflex. But this protection quickly turns into pressure. Tight muscles press harder on the already irritated nerve, which increases pain, which causes even more tightening. A vicious cycle begins. Muscle relaxants are designed to break this cycle. They loosen the surrounding muscles, reduce pressure on the nerve, and make movement easier and less painful. But there is a real trade-off. These medicines cause drowsiness. Some people feel heavy, slow, or mentally foggy after taking them. That is why they work best at night, when your body actually needs that deep relaxation and the drowsiness becomes an advantage instead of a problem. Medicine 4. Steroids, the one doctors hesitate to prescribe. Now we reach the medicine that doctors hesitate before prescribing. And there is a very good reason for that. When pain becomes severe and nothing else is working, doctors may turn to steroids. These are powerful anti-inflammatory medicines that act fast and aggressively. In some cases, the relief feels almost immediate, almost like a miracle, and that is exactly why they are dangerous to misuse. Steroids are not a medicine you should reach for casually. Used too often or without proper control, they cause serious long-term damage, weight gain, blood sugar spikes, weakened bones, and a suppressed immune system. They are reserved for short-term intense situations where the pain is unbearable and other options have not been enough. Fast relief, but absolutely not a long-term answer. So what works the fastest? Here is the honest answer. It depends entirely on your type of pain. If inflammation is the main issue, NSAIDs or steroids will act the quickest. If the pain is nerve-based, sharp, burning, electric, nerve medications will ultimately work better, even though they take time to build. And if muscle tension is driving your pain, muscle relaxants can bring real and noticeable relief. But here is the truth most people never hear. Fast does not always mean effective. And effective does not always feel fast. The right match matters far more than the strongest drug. Choosing the most powerful option for the wrong type of pain gives you temporary quiet, while the real problem continues underneath. This is where things go seriously wrong for most people. They treat sciatica like it is only a pain problem. So when the pain increases, they simply increase the medicine. More pills. Higher doses. But sciatica is not just pain, it is a nerve problem with a physical cause. Medicines can silence the pain. But the problem is still there. A slipped disc does not fix itself just because the pain feels better today. And this is exactly how people get stuck. Temporary relief, but no real solution. The cycle continues. Months pass, and the pain keeps coming back. So what should you do instead? First, stop guessing. Short-term use of the right medicine can absolutely help manage pain while your body heals. But if your pain has been lasting more than a few weeks, keeps returning, or is getting more intense, that is a clear signal that medicine alone is not enough. You need proper evaluation. A physical examination, possibly imaging. A treatment plan built around the actual cause, not just the symptom. You are not stuck. You are just missing the right information. And now you have it. Sciatica is manageable. But it only responds when you treat the source, not just the pain on the surface. The right medicine, for the right reason, at the right time, that is what actually works. Sciatica pain can take over your life, your mornings, your sleep, your ability to move freely. But the right approach can take that control back. And it starts with one simple shift in thinking. It is not about choosing the strongest medicine. It is about choosing the right one for your specific type of pain. That one decision can completely change how fast you recover. Now, before you do anything else, drop a comment below and tell us just one thing. Where do you feel your sciatica pain the most? Is it stuck in your lower back? Does it travel into your hip? Or does it shoot all the way down to your foot? Your answer takes 5 seconds, but it might be exactly what someone else needs to read to realize they are not alone in this. If this video helped you see your pain differently, hit the like button right now. It takes 1 second, but it helps this reach someone who is sitting somewhere right now, dealing with the same pain and not knowing where to turn. And if you are not subscribed yet, subscribe now and turn on the bell. Because we are releasing more videos on sciatica, exercises that actually help, treatments beyond medication, and what to do when nothing seems to be working. Sciatica is not the end. With the right information and the right treatment, recovery is absolutely possible. We will see you in the next one.